Okay, a quick review of blood flow, blood pressure, and blood resistance. On the graffiti page, here in the corner, here's a quick way of analyzing blood flow, pressure, and resistance. Very quick summary. Starts off with the idea that, okay, here is a vessel, and blood moves through the vessel from higher pressure to lower pressure. So if there is a pressure gradient, the blood will move from the higher pressure to lower pressure. That's blood flow. The equation we can use for this is blood flow is equal to the difference in pressure divided by the resistance. And this would be used in a regional analysis of blood flow. So if the blood pressure is higher here than it is here, blood goes from high pressure to low pressure. And this says that's true. Now, if the blood pressure here and here was the same, then there would be no difference, and that would be the number 0. And 0 divided by anything would be 0, and there would be 0 blood flow. So it's mathematically logical as well as it's just conceptually logical. Another idea is resistance right here. Well, in an equation like this, if the denominator gets larger, it makes the value smaller. So the greater the resistance, the less the blood flow. The less the resistance, the greater the blood flow. And that makes sense. If something is trying to prevent blood flow, if that gets larger, the blood flow becomes less. Another example of blood flow is cardiac output is equal to heart rate times stroke volume. But this specifically is talking about the blood flow, say, from the left ventricle into the aorta and over to the body. So this is the volume of blood coming through the heart on the right side or the left side per minute, and in essence it represents blood flow also. Next idea here is blood pressure. While the blood's moving through the tube-like structure, it is pushing perpendicularly on the walls of the blood vessel, and that's blood pressure, perpendicular to the direction of the blood flow. An equation for this would be blood pressure is equal to cardiac output times peripheral resistance. And we'll talk about blood volume after a while too. This thing makes perfectly good sense. Again, cardiac output says how much blood are you shoving into that tube. The more you shove into the tube, the more crowded it is, and that's what blood pressure is. Peripheral resistance says, well, again, how much resistance is there to the blood flow, how much constriction is moving in on this thing, and if this number gets greater, that number will also get greater. Now, something we can throw in right here is the fact that when the blood pushes the walls of the vessel out, the walls of the vessel are resisting by pushing back in. So, the normal amount of vasoconstriction that's located inside the walls of the blood vessels is called vasomotor tone. It's caused by vasoconstriction of smooth muscles. And most of that vasoconstriction is being controlled by sympathetic innervation. And much of that sympathetic innervation is coming directly from the vasomotor center of the medulla, which will decide how much resistance there is and therefore has a lot to do with blood pressure. More about that later. The fact that the blood is pushing out and being pushed back, that's what creates the pressure. If for some reason there were no vasoconstriction, if the blood pushed the walls out and the walls just expanded outward, the blood pressure would go to 0. So if this becomes 0, that becomes 0. So the normal amount of vasoconstriction on blood vessels is extremely important. Again, that vasomotor tone is extremely important. And the vasomotor center is in large measure responsible for maintaining that vasomotor tone through a stream of sympathetic innervation. Next idea here is resistance, which I should have dabbed out here. When the blood moves through blood flow, when it pushes against the wall, which pushes back, that's going to be blood pressure. But the friction up against the wall represents resistance. Now, peripheral resistance is due to 3 main factors right here, and that's length of the blood vessel, viscosity of the blood, and size of the lumen. In this chart down here, we can see, or we can visualize, that if you're thinking about the peripheral resistance going up, one thing they can do that is increase length. The longer the path the blood has to go through, the greater the opportunity for friction. So, a longer pathway represents more peripheral resistance. However, a shorter pathway represents less peripheral resistance. And blood tends to flow along the path of least resistance. It will take the shortest route. And that, in essence, is what the term short circuit means in reference to electricity. Well, it kind of applies here too. The blood goes along the shortest path, in essence, to avoid the resistance. Viscosity of the blood is a factor also because as you make the blood thicker, it is just rougher on the inside wall and there is more drag. So a thicker blood, more viscous blood, denser blood is going to create a higher resistance. However, less viscous blood, more watery blood, will be less like sandpaper, and so therefore there'll be less peripheral resistance. Now, these things right here do have something to do with peripheral resistance. But changing these things, trying to perhaps change something here or change something there, is a matter of minutes, hours, days, weeks. To do something much quicker, it's easier to change the size of a lumen of the blood vessels. So, if you were to decrease the size of a lumen of a blood vessel, that would increase the peripheral resistance. Sort of like saying if you made the halls in the academic building more narrow, it would be more difficult for people to walk through those halls. However, on the other side, if you make the halls wider, there would be less resistance. It'd be easier for things to move through. So, when we're talking about changing peripheral resistance in reference to this part of the equation, or even that part of the equation right there, the quickest, most efficient way to do that is to change the size of the lumen of the vessel. And the way to do that is to increase or decrease vasoconstriction. To increase vasoconstriction, you send more sympathetic signals to the smooth muscle inside the wall of the vessel. The smooth muscles pull in a circular pattern and they make the lumen more narrow, thus increasing peripheral resistance. When you reduce the amount of sympathetic signals going to those smooth muscles, they pull less, the blood pushes out, and there is less vasoconstriction. The lumen gets bigger. So, to change the peripheral resistance, it's easiest and quickest to change the amount of sympathetic innervation going to the smooth muscle of the blood vessels, and this is where the vasomotor center of the medulla comes into play. By the way, back up here, I forgot to talk about BV standing for blood volume. Blood pressure is due to cardiac output times peripheral resistance. But cardiac output is basically just talking about how much blood is being shoved into that vessel per minute. Well, blood volume is part of the story too, because if for some reason your blood volume was going down, say for example you have a wound and you're bleeding, the blood volume would go down, the amount of blood inside the vessels would go down, and the blood pressure would go down. So this doesn't play exactly into the formula, but you can tell that less blood volume would mean less blood pressure, and more blood volume means more blood pressure. Now, more blood volume is usually not an issue, but if you drank a huge amount of water and your kidneys weren't functioning very well, you could increase your blood volume, and that could lead to an increase in blood pressure.